Okay, now we're going to do the cervical spine, and I want to just orient you a little bit about some of the things we're going to be talking about here. And what I want to stress to begin with is we're going to be looking at a lot of different cervical pathologies, but as far as the treatment of patients is concerned, it all begins and ends with postural dysfunction. And by that I mean the postural dysfunction probably is the most common entity in and of itself that causes cervical pain or cervical dysfunction. And what you want to understand is that almost all these pathologies that we're going to talk about begin and end with postural dysfunction treatment. Many times, if postural dysfunction isn't the actual cause of the problem, then it is a sequela of the problem, or it is the cause of the problem that is more oriented in a tissue diagnosis. Many times the sequela of these postural dysfunction situations end up in a radiculopathy that can be corrected and or cured with changing the postural dysfunction of the patient, because that's what caused it. Or the radiculopathy in and of itself may have caused, and does many times cause, the problem, but it almost always ends up in postural dysfunction also. So what I'm just trying to get across to you is that you're going to be treating a lot of different things with a lot of different kinds of modalities and routines, but they should all pretty much end in postural correction of the patient, so that whatever cure we've been able to attain will be permanent, or at least not as recurrent as it would have been had we not addressed the postural dysfunction itself. So beginning and ending, you're always going to be working with the postural dysfunction. You know, the head and neck are not really built like the low back or any other part of the body to sustain the kind of weight it has to and the stresses that it has to without good mechanical advantage. If the mechanical advantage is changed so that the neck is put at a disadvantage, then you're going to have lots of problems. But if you change the patient's posture, and it's so simple to do and to understand, that you need to just be sure you do that. And all treatment, just remember, all the treatments that you do with cervical patients begin and end with postural treatment and correction. It's just like the low back. If they don't maintain good posture, then you're going to have more recurrences. It's just, you know, if a low back patient continues to sit in a flexed posture, he's going to have more problems. If you know, what we like to say is all low back treatment begins and ends with lordotic sitting, in terms of, at least in terms of an extension principal patient. And if they don't pay attention to that, then they're going to impede or accelerate recurrences. And that's the same in the neck. You're just going to make sure you begin and end with postural treatment. Okay, so beyond that now, we're going to look at the cervical spine and look at a lot of different kind of problems that we see there, and a lot of different pathologies that may cause cervical pain. Some of them are very serious. Some of them, like I said, are just mainly postural problems. So we're gonna go over, quickly go over a lot of the, just a little, not a lot. We're gonna go over the bones a little bit and neuroanatomy a little bit, and then get into some of the things that may cause problems and how to deal with them. Okay, so we're going to stop for a minute.